This is Emily Walker, MedPage Today, reporting from Capitol Hill, where on Thursday various doctors' groups gathered to protest current healthcare reform efforts as part of the so-called Million Med March. There were closer to a few dozen doctors rather than a million doctors, but they were all here for one common cause. They're against current reform efforts, and they have some ideas of their own on how to reform the system. On Thursday, I spoke with the president of one of the doctors' groups, Docs for Patient Care, Dr. Scherz, who is a urologist from Georgia.
We're standing up for the patients and for patient rights against government takeover of health care. And we're determined not to allow the government to do what they plan to do, which is to try to stand between us and our patients.
Dr. Scherz is concerned about the Comparative Effectiveness Research Council that the bills would establish. Basically, the council would direct and disseminate head-to-head clinical research that could be used by physicians to make clinical decisions. While members of Congress say that comparative effectiveness research will not be used to decide which medical treatments will be covered by insurance and which won't, some are worried about a so-called government takeover, like Republican Representative Broun of Georgia, one of the 3 Georgia physician congressmen who spoke at the Thursday rally.
Colleagues, what's going to stop Obamacare? You will.
If H.R. 3200 goes into effect, there will be less choice as far as health care is concerned, health care insurance. And the problems are that there are 2 problems, access and cost. Those are really the 2 big problems. The way that the government wants to address this is they want to completely dismantle the system that exists right now and replace it with another system where insurers will have to they'll have to comply with very stringent government regulations. Not only that, but eventually those government regulations will push private health care insurers out of the market until there's really only one insurer, and that's the federal government. Once the federal government is the only insurer, then there'll be no choice.
Dr. Scherz is referring to the bill passed out of the 3 House committees that would establish a government-run health insurance plan to compete with private insurance companies. While many House Democrats say the public plan will spur private insurance companies to be more competitive, Republicans and some conservative Democrats agree with Dr. Scherz that the public plan would drive private companies out of business. The bill, which is soon to be reported out of the Senate Finance Committee, would not create a new national insurance plan.
Because of you and because of these efforts, I think this public option plan is dead on arrival.
Dr. Scherz said the Senate bill, which would likely cost around $850 billion, is too expensive.
It's just too expensive, and those costs need to come down. And there's ways of doing that by having insurance available over the internet and across state lines, which right now are not possible. There's ways of decreasing costs by promoting competition, by empowering people to become consumers. There are dozens of other ideas out there if somebody would listen. Doctors are very smart people, but unfortunately we have not been engaged. Nobody has asked us what we think, and we're the ones on the front lines who are taking care of patients, so we really know what's possible and what's not possible.
From Washington, I'm Emily Walker, MedPage Today.